Good afternoon. This is TTT Live and TTT Live online on Facebook. I'm Dike with a COVID-19 review. To start off, government is arranging to repatriate local students who are attached to UWI campuses, both in Barbados and in Jamaica, from the first week in June. The confirmation came this morning from National Security Minister Stuart Young, who said special arrangements are being made with Caribbean Airlines for those who wish to return to Trinidad and Tobago. Minister Young said returning nationals would have to quarantine for a 14-day period before coming home. And the Minister of National Security,
Barbados, and we're going to conclude those discussions. We're going to speak to the Prime Minister of Barbados to make the offer that students in Barbados who want to return, once the Barbados government welcomes it, we will take them to Barbados. We will then go to Jamaica, bring down the students from Jamaica to Barbados and to Trinidad. But you must quarantine for 14 days there. You must also then, when you return to Trinidad, you will be put into state quarantine for another 14 days.
And the minister this morning gave a review of the measures easing the COVID-19 restrictions, including those referring to food places.
Street vending of food and beverages, all retail food services, delivery and takeaway food services shall only be open for sales to the public until 8 p.m. every day. This is a measure where we've opened back up that industry, and it includes all of the food items, itinerant, non-itinerant, and you're allowed to sell until 8. We're asking people, please close off at 8. This is being done for the specific public health and regulations and to allow us to be able to police it, for want of a better phrase.
As vendors already take advantage of this change and have opened in many parts of or many areas, the minister clarified that not following all the rules surrounding this new regulation could lead to serious trouble with the police.
What I'd like to now point out, though, we have made it an offense for any in-restaurant dining, and by restaurant it's not only the formal restaurants. In all of our different outlets that sell food, there is to be no in-house dining. That is now a breach of that, would be an offense under the regulations.
Now, the minister says you can pick up your food, but it must be taken away, whether to your home or work to be eaten. So no liming, no congregating. Get your food and leave, please. Thank you. But in today's mental health moment, we are discussing relationships and abuse behind closed doors. With us today from the executive of TCHAP, or the Trinidad and Tobago Association of Psychologists, is clinical psychologist Deborah Riviears. In furthering her learning, she is looking at male victims of intimate partner abuse. So I want us to start there. So saying good afternoon to you, Miss Riviears.
Good afternoon, DK. How are you?
I'm all right, thank you. Now, I saw some of the work that you're doing in terms of further learning. So I want to start there. How does male as the recipient of intimate partner abuse factor in Trinidad and Tobago?
Okay, well, you know, males are also victims of intimate partner abuse. However, they are not men don't be victims. It's not accepted really for men to be victims. So when a man is a victim of intimate partner abuse, it goes with a lot of shame, a lot of stigma, based on socialization, based on how we look at men and women in Trinidad and Tobago. So they may not come forward either to the police, go forward to the police, or they may not want to say that they are victims because it's not very manly for a man to say that they are victims.
Now, with regard to shame and stigma, that is increasing at this point in time. So let me jump into the question of asking why or what are some of the reasons that domestic abuse may increase during times of crisis?
Okay, well, as we know, we are in a pandemic right now, and because of several reasons, some being frustration, the loss of income, the loss of jobs, the closure of schools, unpaid bills, and then just the social isolation, which is really critical at this time. You can find domestic violence on the increase because of the fact that persons are not allowed to be out as much as they would like to be in normal times.
So we have these stressors increasing during a time of crisis during this pandemic. what are some of the recourses that we have? What are some of the ways that victims can get help during a time like this?
Okay, well, if it is informal help, it would be nice that the victim would have someone to speak with, whether it be a friend, whether it be a neighbor, someone who can listen to them. And of course, formally, you would like that the person is able to make a report to the police. You would like that the person can call one of the hotlines. You know, there are hotlines, including TTAP's hotline at this time, whereby persons may be able to get some type of help, psychological help, over the phone. And hopefully that can lead to a meeting whereby, more can take place where they'll be able to discuss further their situation at home.
Well, not all abuse is physical. So I'm wondering, where do we draw the line between things like fatigue or running jokes? I can imagine somebody saying, I'm very glad that KFC opened because of the way that you're cooking at this point in time. But where do we draw the line between fatigue and jokes and something like psychological abuse?
Particularly in our environment, Dike. Now there are jokes, and you can make a joke, but a joke is different to abuse. If you are constantly belittling someone, so it's not just about the KFC and the food, but you're constantly telling them their food is not good, they're fat, they're ugly, they can't do this well, they can't do this like someone else. And you may be laughing while you say, that is no longer a joke. It takes a toll on a person's psychological psyche, how they feel about themselves because you're belittling them, their self-esteem is now compromised. And then because of the social isolation, which I'm repeating again, that means they may not even be able to reach out to another person. So they're only hearing what you are saying, and what you're saying is not really a nice thing at this time.
We just spoke about psychological abuse. I want to take it back to physical, please. And what are some of the practices that people can implement where they can use that to help them in securing their physical safety?
Okay, well, with physical safety, you always have to look at what do I need? You must have a plan. What is my plan? Should something happen, because instances would have occurred before, what is my plan? Do I have numbers that I can call? Do I put my documents, my important documents in a file, in a waterproof folder where it can be safely kept? Do I keep certain things by a neighbor? Do I, how, if something should happen and I call someone, is there a code that I may give to them and they would recognize the code so they will know one time, I should call the police. I think she's in trouble. I think he's in trouble. So those are some of the things that you may be able to do to help the situation.
Now, putting things by a neighbor brings to mind some of the stay-at-home measures that we're still experiencing, even because things have now started to relax. If you are more isolated than usual, what are some of the impacts that can start to manifest or present?
Okay, well, because of the isolation that persons are going through, that can really have a big impact on their mental health. Isolation, being away from persons, has been linked with persons becoming depressed, persons fearing, they're alone, they have no one to speak with. And research has also shown that this can be linked to a decline in your cognitive health and your intellectual functioning. So that is why it is always advisable that we reach out to persons. There are different ways we can do it. If not in person, whether it be over the phone, we use the different media that's allowed. We chat, we video chat, we send a letter, even though letters are not done anymore in time, but things like that. So you keep in contact and you allow persons to call you. And that should alleviate some of that isolation.
It kind of reminds me of the health minister making a distinction between social distancing and physical distancing, so you can still have those social connections. But in closing, I'd like you to give me some final words in terms of isolation and abuse and things we should be mindful of, especially during this period.
Okay, now with the lockdown, we know that women would be restricted. Their movements are restricted even more than they're normally restricted. Therefore, they have less access to support, whether it be formal support or informal support. Women are not only under lockdown, but men are also under lockdown. And with men being under lockdown, the measures that they might have taken to escape being violent are no longer possible as well. Because they may have gone out, they may have gone to visit with friends, gone to recreate, socialize. So those are some of the things because of the pandemic, because of the lockdown, we find that persons' access to support, be it formal support or informal support, whether it be churches, whether it be groups, community organizations, it's no longer possible in the way we are accustomed to. So now we have to come to a new norm and realize that let's use the measures that are there so I am not isolating myself from everyone.
All right, so we want to thank you so much, Ms. Lee Riviears, and as TCHAP as well, for the work that you do and continue to do. And our final conversation before we take a break on mental health moments, it will be this Thursday dealing with coping with COVID-19 during pregnancy and postpartum. So you can look out for that Thursday, TTT at 2 p.m. Now for a look at the effects of COVID-19 in the Caribbean region. Grenada is hoping to reopen their borders in the first week in June. And this from Prime Minister Dr. Keith Mitchell in an address to the nation on Sunday. He said this will only occur once the requisite protocols are in place. As of now, the Grenadian Prime Minister said they are not there yet.
We therefore expect to open our borders in the first week of June. I assure you, fellow Grenadians, we'll not move unless we are satisfied that adequate health and safety guidelines are in place.
The Prime Minister of the Bahamas, Hubert Minnis, has announced that repatriation flights for their citizens will be temporarily suspended. In an address to the nation on Sunday, Prime Minister Minnis said a national honor flight, which arrived in Grand Bahama on Friday from Florida, tested positive for COVID-19, putting the other passengers at risk of contracting the virus. He said the proper protocols were not followed, as he explained that all passengers were supposed to be tested before.
Three individuals traveled with this passenger. All four of these individuals have been tested again upon arrival, and we are awaiting the test results.
Jamaica now has over 500 confirmed COVID-19 cases. The country's Ministry of Health and Wellness said so far they have had 90 recoveries. In the last 24 hours, 4 new positive cases were identified, bringing their total to 502 as at Sunday evening. The 4 recent cases are all males between the ages 17 to 63 years old. Some 61% of the confirmed cases in Jamaica are females and 39% males, while the ages of all confirmed cases range from 2 months to 87 years. And that's what's trending on COVID-19. Remember, you can join us for live coverage on TTT, Chalk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, as well as on Facebook at TTT Live Online for all your COVID-19 updates. Thank you for joining us. On behalf of the TTT crew, I'm Dike Rostant. Bye for now.